So I think I have to backtrack about the cyclosporiasis, which turns out to be a bigger deal than I thought it would be. As you probably heard, it's now in most of the states. There have been a couple of deaths and there have been several hundreds hospitalizations. I'm a little perplexed why it's hasn't gone away quickly. So I guess we all have to pay attention to it. So definitely wash your produce well. Um, if you do get sick, it will look like anything from very mild gastrointestinal illness, just diarrhea, to quite severe, to the point of severe vomiting, high grade fever, abdominal pain. So could look very variable. If you get one of those more serious conditions, there are treatments. So there's actually an antibiotic that is prescribed, even though for most people it will be a self resolving without anything you need to do. It just passes. But you need to be on the lookout. Why? In contrast to a viral gastroenteritis or viral diarrhea, this one has a little bit of a risk of turning into a much more severe complication. And obviously, this impacts more people who immune compromised or have some other pre-existing gastrointestinal problems. So if you one of those people, I basically suggest if you do get that illness that you go to urgent care. You're probably not going to be able to reach quickly your own doctor. And urgent care, they can test for it. The test is a stool test, and it's pretty quick turnaround. If they find it positive and you're not getting better quickly, then you get the antibiotic, and usually that should suffice. Meantime, of course, if you decide not to go anywhere and you continue kind of manage at home, just make sure you're hydrating very well. Diarrhea can be quite watery, so probably best to use electrolytes, not just water. So I'll pause with that. But meantime, I'll gonna highlight what I did this week and last week, which is we went kayaking. Let me see if I can show you a little funny thing here. Let's see, where is okay, so you guys seeing this on my screen? So it turned out that my dog Shabu is a very proficient fisherman, and he was helping me to catch a lot of fish. And this is our ongoing dogs talk integrative medicine. This is not very integrative medicine. It's just a joke about our trip. But if you guys like this kind of thing, please subscribe so you can just come over here, click, give us your email if you're not already, and you're going to be getting this once a month. We're trying not to do this overwhelming, so I'll put the link to the C-IAYT here. It's Angela's doing this pretty pictures using our dogs. Usually there's a topic that is a bit more integrated. All right, let's do Q&A. I don't have any other specific topics for today. While I'm waiting for your questions, I will post a couple of recent YouTube videos that you may want to check out. So I finally gotten to review our own study. So as you know, we are in the frontiers of reversing Alzheimer's disease. Our reversal rate is somewhere around 30 to 40% with complete stability of about 50% and people progressing with Alzheimer's only at about 25%. So we just published a study about this. And what I'm going to give you is I'm going to give you a copy to the video in case you don't want to read the whole study, but the description of the actual link to the study is inside the video, so you can take a look. This is a real life experience. This is not a Bredesen clinical trial. So obviously, Bredesen clinical randomized controlled trial that has not been published yet. They're just going through a review. That has been better results, but there's an explanation. So watch the video. It'll tell you why our results are not as great. In short, we have much older population by more than 10 years. And also, people have to pay for it, right? So we don't have any assistance for this program. And as you know, it's of course non-covered service. But, again, medications give you zero chance of recovery, zero chance of arrest, and basically just some chance of slowing down. And we give people about 30% reversal, complete reversal, and about 50% non-progression whatsoever. So, I think this is pretty good data, similar to a little worse than what Bredesen finds, but, so that's one video. The other video, there's two other videos, which I think I haven't shared with you all. So one other video is about effectiveness of cannabis for patients with hypermobility syndrome. So I finally recorded the video. The video is based on UK studies. Unfortunately, in US, EDS and hypermobility is still, I would consider, an orphan disease. Most clinicians have no idea how to handle it or what that even is. In fact, sometimes doctors don't even know the term EDS, which is kind of crazy, but it is what it is. We live in a country that, if there's no drug to fix, there's no treatment and there's no public awareness, unfortunately. In England, they have a very strict system. It's very comprehensive. So the cannabis has been on their radar for a long time, in part because obviously England has medication that is pure extract of cannabis available for the entire country through the prescription, fully covered by their healthcare system. We don't have that. We don't have the side effects in this country. So, take a look at the video if this is applicable to you. And the last, I don't know if I posted this, but I will put that anyway. So this is the video about Abby Rosner's new book titled Psychedelics and Aging. Can They Help? It's a fascinating book. I highly recommend for you guys to read it. So I'm putting it right here. And yeah, so if you haven't read it, take a look at the video at least. It's a really interesting topic. And we basically, Janet and I, sat down with Abby quite a while ago and did a podcast. So it's available now on YouTube, but if you prefer to watch it, listen to it on a podcast, just go to the GW Integrative Medicine podcast. Maybe Stephanie or Janet can throw the link as I'm answering the questions. All right, let's do Q&A for next. How much time do I have? 10 minutes? Can I take 10 minutes? Maybe even a little bit more. Okay, so let's see. Is there a list that can be compiled for all types of product produced that has not been? No, I don't think so. I has not been implicated. Yeah, I don't know how to do that. I think the we don't even know, right? So there's only official incremented list has been lettuce in Michigan, but we don't actually know where most cases come from. So I don't think that that's possible to do. That actually makes things a lot more complicated, right? Because I think maybe that is the reason why they have been slow at kind of arresting the progression of something that you would expect to go away very quickly. This organism exists everywhere, so it's not a new problem at all. And it's just surprising that it's quickly became to the level of spread we currently see. So it's a good question. The people in your dementia versus those who have dementia, both. So the prevention is 100%. We haven't had a single patient in over several hundred of patients progress to Alzheimer's in our program. But no, I'm talking in this study that published in the video I discussed, those are the patients with existing dementia. And they're variable. Some of them are mild dementia, and I have some patients who've never progressed with very advanced form. In fact, if you haven't watched my TEDx on this topic, which I can probably post here, then you will see that part of the TEDx presentation is all about that case that spiked my entire path in this field. And basically, the point is, actually, yeah, I probably shouldn't say. I think in that TEDx I call him Jack. So Jack had lived for 10 years after I inherited him on hospice. So I completely arrested his progression, made him a little bit better, and he lived for 10 more years with Alzheimer's. When I inherited him from the hospital admission, and he was discharged to home with hospice because they said he only had a few months to live, and he lived for 10 more years. So this was the first case. And now we do have cases like this in the practice, but obviously we prefer to take on patients who are early in the process. Otherwise, the chances of reversal in advanced Alzheimer's, I think, are non-existent. We just can slow down and maybe even arrest progression, but I don't think we can reverse the advanced forms. The reversal occurs in people who present early. So this is a very good question. And by the way, so cognitive impairment and dementia. So let me clarify a couple of points because there's a lot of confusion with this all the time. So dementia is a generic term that we use still, but it doesn't describe anything. Dementia simply says there's some kind of a cognitive impairment. Cognitive impairment is a generic term. What I specifically address here is only an Alzheimer's disease. There are dozens, if not hundreds, of types of cognitive impairment, and depending on what that cognitive impairment is from, the treatment is going to be very different. There are patients who will never develop Alzheimer's, but will develop cognitive impairment from, wrong medications or from other issues. So, like for example, you all heard Bruce Willis, who suffers from frontotemporal dementia, very different disease. Bredeson's group is beginning to look into that disease. I've only treated maybe a handful of patients and never had any successes with this condition. So again, it highlights the differences between different types of memory loss or cognitive impairment. Great question. But I think interestingly for prevention, though, it's a lot harder to judge. So for the prevention, I would say using some formal cognitive impairment prevention program if you're concerned, whether because you feel like your memory is worsening or you have a strong family history, that seems to be universally effective. It doesn't seem to matter, what type of prevention are we putting in. And this is, again, if you look at the video, if you look at my TEDx, and also let me give you the Lancet study. Just I'm going to give you two other links in there to take a look. So first I'll give you my TEDx link. Give you that. So that's the TEDx link. You can take a look. And then the second, I'm going to give you a link to the Lancet Commission. So Lancet Commission would be considered as of today a gold standard in care of Alzheimer's internationally, not in US. Lancet Commission is European Commission, but US supposed to be participating in that commission, although I don't frankly know if that's true. But the Europe is using this as a gold standard. And so this is the document from the Lancet itself. Lancet can be looked at upon as New England Journal of Medicine in our country. So it's a number one journal probably in the world in terms of the level of evidence. So this is the specific link. All right, let's keep going with the questions. Okay, where we are. Okay. Is it safe to avoid chopped or bagged greens altogether for time being? Yeah, Linda, I don't know if that's the only source. I presume that it's mostly greens, but it's probably fruits to some extent as well. I think I would suggest washing all the greens for time being until this completely goes away. I know that many of us don't wash certain things like greens and berries, for example. I probably would wash them for time being if you're even semi-concerned about this. Yeah, because you also can say, look, let's say, let me give you two examples. A person could say, look, I'm 45, completely healthy. Should I worry? Nah, probably not. I mean, you'll get diarrhea, it'll pass, you'll be fine. What if you're 75 and you have, ulcerative colitis? Well, I probably would wash all the produce for time being, or if you're super worried, maybe for time being, you should cook your produce. Obviously, cooking will kill this organism instantaneously. Any kind of boiling will eliminate it immediately. So this only applies to raw food, obviously. Okay, Linda has another question. Do you have to be on keto? No, great question. So this is very important. So keto is an option. It's a good option, but it's definitely not the only option. In fact, Linda, to your point, we have less than 50% of patients in our program is now on strict keto. Probably no more than 30%. There are two reasons for that. One, it's a very restrictive diet. It's not easy for a lot of people. I mean, people tend to lose a lot of weight on keto. People can sometimes develop this chronic, what's sometimes called keto flu. People describe that like you have this flu-like symptoms. Sometimes they go away within a week or two. Sometimes they don't. Sometimes they linger for a long time. So people don't like that. And also, a lot of people just don't really feel well. Like they just don't get that. Versus, there are some people who swear by keto. I have patients who start on keto, have dramatic cognitive improvement within a week, and say, "Oh, I'll never go off of it." Okay, well, great. Don't go off of it if there's no side effects. There is the problem with keto is a lack of understanding what happens longitudinally for more than, say, 12 months. There's been a strong signal of chronic substantial microbiome disturbance on keto. We don't have enough data on safety, so I can't tell everybody you're safe to stay on keto forever. Now, let's say, for example, person has this chronic seizure disorder and they went on keto and seizures stopped. Well, I'm not going to argue with a case like this. I'm going to say, well, you probably should stay on keto forever because the medications that you're going to take instead of that would be more toxic than a keto. But that's how you think here. And a lot of people are perfectly fine with Mediterranean-like anti-inflammatory diet. I think it's again it speaks to the same truth. I feel very strongly that like the looking for universally effective diet for everybody is a past century thought process, completely outdated. Diets have to be personalized. They have to include deeply your personal genetic makeup. Ancestor diets are probably a lot better for most of us. So if you're from Asian descent and you're starting to eat completely different diet that you've been before, we know what can happen, right? There's a good example, multiple good examples when people move countries and they switch from what they're reading in one place to what's locally culturally adaptable and what happens, right? So that has to be one important point. Understanding your own genetics and your own predispositions and kind of titrating that diet to that is probably another really important point. So, unfortunately, or maybe it's fortunate that, we just simply cannot say, okay, best diet for this. Yes, the science points out that for a lot of cognitive deficiencies, for a lot of brain problems, keto seems to be then the one diet everybody should at least consider at some point. But it's definitely not universal. Great question. Thanks for that. Does cannabis help reverse or not let progress dementia if not sure? Yes. So, Sonia, great question. We have a video on this whole topic on the YouTube. Let me see if I can quickly pull that up. There's a lot of interest in cannabis as a potential even medication for reversal of Alzheimer's. No one knows the dosing. There seems to be a lot of confusion about this because obviously cannabis in young age at high dose recreational can actually sort of diminish brain capacity and make you dumber. But turns out in an older age, it's the reverse. So in an older age, there seems to be a signal of the fact that actually can use cannabis for improvement of memory. And I'm trying to find a video, and maybe I'll do that a little bit later. I don't want to get disrupted. I have a video on our YouTube channel describing that. Oh, thank you. Somebody posted. Great, great. Thanks, Steph. But we don't really know. What we do know is that when Alzheimer's progresses about 3 or 4 years into the dementia, everybody loses endocannabinoid tone. So as you all know, we make our own cannabis. The cannabis regulates our memory processes, sleep, appetite, lots of other things like stress response, trauma response. That's all our cannabis. In fact, that's a primarily regulatory molecules that are cannabis-based. And the cannabinoids, the term. 2-AG and anandamide are most common, but there are other. So exogenous cannabinoids fit in instead, and the study that's linked over there, thank you so much, that specifically reviews a microdosing, and we're talking about less than a milligram. We're talking about a third of a milligram twice a day of THC. It's really nothing, but seemingly improving memory. My prediction, I have been always aggressive about this. My prediction is in 10 years, cannabis will be standard of care for all patients with Alzheimer's disease, just because we know for a fact that you stop making your own cannabis as disease progresses. Why that is and what the pathways to that is not yet known, but you can imagine there is already a pharma that's trying to come up with drugs to intervene in that spot. I kind of feel it's funny. Why would you do that if you have an available THC that's much safer than anything they'll ever produce? But anyway, that's just a side note. Okay. Can I take a couple more minutes since the questions are coming in? Is that okay? All right. Um, okay. Are you saying that we can't really consider any produce safe? Yeah, I think so. Well, yeah. So unless you wash it or cook it. If you wash it thoroughly or you cook it, I think it's safe. But yeah, I mean, actually, Randall, that's a good summary of the situation. I mean, until this goes away, again, unless you don't really care. If you feel safe that your disease is going to be mild, then what do you care? It's not any different than all other diarrheal infections that are going around. Can hearing aids for those hearing loss? Yes, great question. In fact, it's one of the 14 preventable causes of memory loss, the hearing loss. So that Lancet Commission, the link above, that's thelancet.com, that is actually describing it. It's one of the 14 most important drivers of Alzheimer's is a hearing and vision loss. So that is why anyone with hearing loss should really fix this, and fix it as soon as you can. The reason is if you don't have that input, whether it's visual or hearing, unfortunately the brain needs that stimulation as much as possible. And so once you take that stimulation away, there's a progression. It's well established. What washing process do you use? I don't know. Um, we need nutritionists to answer. We will bring nutritionists. That is I mean, I think just run it through running water aggressively, and probably good idea to tumble it somewhat. So if you have a tumbler, you can do it that way. We often, I mean, I know that when my wife preps the salad, she doesn't wash anything, I think. And I don't say anything because I even wash berries, and she always laughs at me, like, what are you washing? Like, in order to wash this well, you have to seriously tumble everything. And how are you going to tumble blueberries? They're just going to, burst and there'll be nothing there left. Maybe it's just placebo for me, but I've gotten used to washing all my produce. I guess since I lived in Israel, I have just gotten used to it. I think that's a common routine there because a lot of time produce state lays outside on the shelves, and so if it's outside to the air, there's always a dust in large amounts. So you just get used to washing it there. But again, it's an interesting question. I don't know how to answer that. Yeah, it is easy to rinse them. The question is, does it work? Because my wife always, she's a microbiologist, she's like baloney. Like washing berries is wasting water because you're not washing anything off. It's different because when you're washing apple, you can take an apple and you can like really thoroughly wash it like this. You can't do that with berries. So, and the same with greens. So the question is, it's actually a question. It's a reasonable question to research how much actual washing of the greens and different vegetables and fruits does to decrease risk. And it's probably highly variable. I predict that washing certain things is very important, like especially when they spraying stuff, like right. So the non-organic, I definitely wash apples and potatoes and everything. But for organic, if you get it, if you grow your own fruits, for example, you just get the fruit off the tree. What could there be? Well, the bird can poop on it. The rain can wash off some stuff. I don't know. It's an interesting question. I don't know how to answer it. I wouldn't call myself an expert in washing of the produce in terms of decreasing risk of infectious disease. I mean, we're washing our hands because that's self-explanatory. But yeah. All right. Well, I think we're good on time. So, Alyson, thanks so much for being here. It's always a pleasure to have you. Welcome back. And if just a reminder before I turn off my screen, if you need to talk to me after, if you're my patient, stay here, and we'll have individual time as usual.
Hi, everybody. Thanks for that. Welcome. And I'm happy to be back with you today. I thought we would do a little bit of a breath observation and an energizing breath practice. There's just been a lot going on, and it's a nice time in the afternoon. Instead of reaching for a snack or maybe a cup of tea or something, we could use the breath instead to create a little bit of energy and awareness. If you're comfortable in your seat, you can stay exactly as you are. If you'd rather lay back or recline in any way, you can do this as well. It is meant to be done seated, but if you'd rather lay back, that is okay too. And if you're seated, try to have your feet connected to something on the ground beneath you, maybe the floor, or if you need to slide something under the feet so they feel even and connected, that could be helpful. And once you're there, if you're comfortable, rest your hands over your belly. Either look down the cheeks slightly or close the eyes if you prefer that. And over the next few rounds of breath, we're simply going to feel the breath move in and out of the belly. And as you get started here, you'll get a sense of if there's much movement at all in the belly. You know, a lot of times midday or throughout the day, if you're feeling stressed, the breath can live a little bit higher up in the chest and the neck. So now with the hands here as a guide, we're using that awareness of the hands to give us some feedback. Breathe the belly into the hands. Notice how it feels. Does it feel fluid and full and easeful with the breath? Or is there a little bit of shortening or texture, a little bit of difficulty around inflating around the belly? No need to apply a judgment or even try to change anything yet. This is a breath observation practice. So we're just checking it out, seeing how it feels. Notice over time as you're breathing into the hands if there's a change in the breath. Maybe you can feel an awareness drop out of the head and the neck and the face and move a little bit down lower, closer to the belly. I always notice after a few rounds here, the exhalation starts to get a little longer, a little slower. And creates a sense of ease and a little bit more comfort when the belly's moving with the breath. And take one more there. Really feel the air move into where the hands are touching the belly. And then a softening on the breath out. From your hands, from your belly, slide your hands up around the ribs. Likely the tips of the middle fingers will be touching. The breath still initiates around the belly, but can you start to breathe the air up into the ribs and around the rib? You might start to feel the tips of the middle fingers start to move apart as you find that full breath in. And then as you exhale, there's a narrowing of the ribs and the tips of the fingers gently come back together. The belly still initiates the breath in. The air travels up and into the ribs. And then you let it go on the breath out. There's this narrowing or coming back together. The tips of the fingers rejoin. Take a few more rounds just like that. With these hand placements around the belly and the ribs, we're really focusing on expansion for the inhalation. So, how much can we take in? How much space do we have to breathe into? And how does that feel? And let's take one more here. If it's comfortable, we'll let the hands just hover right over the crown of the head. If the taking the arms overhead doesn't feel good, that's all right. You can leave them right down by your side. But imagine they were placed, they were hovering right over the hair or the crown of the head. Now feel the breath move into the belly again and into the ribs. So there's that horizontal expansion as we breathe in. And now we'll focus on the breath out. As we breathe out, there's a narrowing and now vertical lengthening. Crown of head stretches up towards the palms of the hands. And try that again. As you inhale, the belly and the chest expand horizontally. And then as you exhale, lengthen up through the crown of the head towards the hands. Inhale, looking for space and fullness. Exhale to lengthen taller, stretching the crown of the head towards the hands. Try it again one more time. Inhale and exhale. Split the hands if they're overhead. They can go wide like a Y or reaching more up like an I. Take a breath in there. As you exhale, bend the elbows, lift the chest. Inhale, stretch arms up. Exhale, pull down. A few more like that. Breathe in. Exhale, pull down. Still feel the crown of the head stretch upward. Inhale, reach. Exhale, pull down. One more time. And pull down. Take the arms up, reach overhead. Take the right arm down by your side. It can touch your chair or whatever you're seated next to. And lift the left arm up and overhead. So create a little bit of opening on the side body here through the ribs. We'll move just a little bit, encouraging some more opening. When you inhale, turn the chest up lightly, bend the elbow. When you exhale, look down at your right thumb, pull your belly button back and kind of reach across the forehead so you get it some opening around the back of the shoulder there. Inhale, turn the chest up and bend the elbow. Exhale, look down to your right hand, reach the left arm across. Inhale, turn up, bend the elbow. Exhale, look down, reach across. Last time like that. Breath in, turn the chest up and bend the elbow. And then exhale, look down, reach across. Push into that right hand to take both arms back up again. Inhale. Exhale, bend the elbows, lift the chest. Feel length to the side of the neck there. Inhale, stretch arms up. Exhale, pull down. Once more. Inhale, up. Exhale, pull down. And then this time we'll take the arms up. Send the left arm down by your side. Open the right side body. Let your left hand rest on the seat or whatever's next to you there. Turn the chest up and bend the right elbow on the breath in. On your exhale, look down at your left hand, reach across, feel the back side of the shoulder on the right. Inhale, turn up, bend the elbow. Exhale, look down, reach across. Inhale, turn up, bend the elbow. Exhale, look down, reach across. Last time here. Breath in and out. Push into the left hand to take both arms up. And bring the hands behind you. So if you're able to interlace your hands, you can. If you are not, just take the right forearm and slide it behind the lower back. And you might rest the left hand there or even just rest the hand on your lap. Either interlaced or hand resting behind the lower back. Sit up nice and tall. Take a breath in. And on your exhale, drop the left ear to the shoulder. So now spend a little bit of time breathing into the right side of the neck. Take a moment to soften the tongue in the mouth, the jaw. We'll move the head gently here. So maintaining that length on the right side, turn the chin down to the left shoulder and then lightly up on the diagonal. Again, gently turn the chin down on the breath in and up slightly on the breath out. Once more, take a breath in, turn down and up. And lift the head all the way back on top. Unthread the right arm. If the hands are interlaced, slide them over to the other side or just let the left forearm rest behind the back. Sit up tall first. And then as you breathe out, drop the right ear to the shoulder. Take a couple of breaths into the left side of the neck there. Soften around the jaw, the lips can part slightly, the tongue in the mouth starts to get soft. And then let's move a little bit gently. Turn the chin down on the breath in towards the right shoulder, and then up slightly on the breath out. Turn the chin down on the inhale. Exhale, turn gently up. One more time. Bring the head back on top. Unthread the left arm. Let the two hands rest right on your lap. Notice how that feels. Soften or close the eyes and check in. How does the breath feel in the belly? Does it lift into the chest? Can you feel softness around the neck and jaw and face? We'll practice now a little bit more of an energizing breath now that we've got a connection to how the breath naturally feels. We'll go slow though, we'll take it easy, and the first round we won't use the hands at all. We might progress to using the arms throughout, but let's keep them in the lap the first round. And so it's going to be a breath in through the nose and then just out through the mouth. Inhale and exhale. Inhale, exhale. Breath in and out. Couple more. One more time. Now just take a natural breath and notice how that feels. Energizing in the body. You might notice a focal point start to develop like around the center of the forehead, even up around the chest. Just stick with the natural breath a few rounds. See how it feels. For the next round, if you'd like to add some arm movements, I'll show those, but you can also keep the hands right in your lap and repeat what we've done already. To use the arms, they'll come forward in front of you on the breath in, and then as you exhale, you'll make little fists and kind of pull the elbows back by your sides. So inhaling, reach, exhaling. two more. Let the hands relax in your lap if you were using your arms. Soften or close the eyes. Check in with the natural breath and how you're feeling. Notice if there's a brightness to your energy, a deepening of the focal point internally. And try to rest your awareness on that as you take a couple of more just easy, steady breaths. And for the third round, you're welcome to keep your hands in your lap or reach them forward like we just did. The third option would be to reach the arms overhead as we were stretching earlier. So the inhale takes the arms forward or up, or they stay in your lap. On the exhale, pull down, make little fists. Inhale. Last two. Let the hands rest in your lap again. Soften the hands. Soften the eyes closed or look down the cheeks. And come back to your natural breath. The breath, the deeper breath might have drawn your attention, your awareness internally a little bit more. Try to rest your awareness on the focal point. Can be the movement of the natural breath, or you might feel a brightness in the crown of the head, in the heart space, maybe even in the belly. Notice what changes as you let your awareness rest on the breath. If you can, start to stretch out the exhalation a little bit in relationship to the inhalation. A beat or two longer helps. If you're comfortable, let a hand rest at heart and belly for the last few breaths, feeling once again the movement of the air around the belly and the chest. Connecting to the impact of just an awareness on breath, a little bit of invigoration around the breath, and then coming back to the steady breath in and out. It's calming yet energizing for the afternoon. Helps us to feel connected to ourself in the moment. Ability to tune inward and check in is deepened. Feel free to keep your eyes softly closed and the hands on the heart and the belly. I'm going to close with a little bit of Om chanting. I'll do 3 rounds. I'll chant. You don't have to if you don't feel comfortable. If you'd like to chant at home, you're welcome to. You don't have to unmute yourself at all. You can just feel the vibration for yourself under your hands as you create that sound. If you'll join me, take a breath in. Thanks so much for having me back today. Join the hands, rub them together, create a little bit of heat. Hold the warmth of the hands right over the eyes if they've been shut. Allow the eyes to feel the warmth of the hands. Gives you an opportunity to flutter open the eyelids and rejoin us here. Thanks so much for your attention. I hope that felt okay. And I look forward to seeing you another time soon.
Thank you, Alyson. This was wonderful.
Thank
Thank you
you.
for being with us. All right. What do we have next week? Steph, Janet. I know I'll be here.
Next week, we have Dr. Ange Mack, and she'll be speaking about perimenopause and menopause.